بسم الله الرحمن الرحيم والصلاة والسلام على أشرف المرسلين سيدنا محمد وعلى آله وصحبه أجمعين. Today I'm going to talk about healthcare from different angles. So we listened to excellent talks that touch the details of using AI in healthcare and technology. I'm going to talk from different angles, which is how to improve, how to get ourselves at the top of healthcare systems. So when we talk about healthcare and healthcare system, how we are going to improve our healthcare system, especially here in Saudi Arabia. Let's talk after that in the Middle East region. Usually, let's know now what are the main components of the healthcare system if we want to improve the healthcare system. The healthcare system usually is based on 5 main components. I think it is working by itself. So we have, for the healthcare ecosystem, we have the payers, people who pay for the healthcare system or services, healthcare professionals, patients, regulators, and industry, including research and development, like the universities, as an example. To answer the question of improving healthcare systems, we can go with any one of these big 5. So these are the main factors. And we can say these are the umbrella factors of AI. When we talk about healthcare systems, according to countries, let's have a look on the top healthcare systems around the world. There are several factors and several criteria that assess the rank of healthcare systems. This is one of those criteria that put South Korea at the top. We can see the list here of different countries. There are different factors, as I said, and we can see the different orders, but mostly those countries remain at the top. So the question here, the next question here, where we are, where can we see the other countries? Is there something missing? The answer is no, just a little bit of work. So, what are the factors that used here in this classification or this ranking system? We can see here they use 5 main factors: infrastructure, government readiness, professionals, medical availability, and the cost of the healthcare system. Or the healthcare, let's say, services. From now and so on, I will say services. This one is one example, and here is another example from the Commonwealth Fund. I put the references down of each of these slides, so you can have a look on them. When it comes here, we can say different criteria to assess the readiness and the rank of the healthcare systems globally. However, as I mentioned before, most of those countries, or the previous mentioned countries, remain the same, with different order. So they cared about the care process, let's say the prevention, self-care, coordination, patient engagement, for the accessibility of the healthcare system or services, affordability, timeliness, healthcare outcomes, population health. Sorry if I talk a little bit quick, but because of the time limit. And we have also the equity. All of these factors are included. So again, the next question, how to improve ourselves? We mentioned different or several factors before, and here are other factors. So we can work on any of these factors to improve our healthcare system. So how to improve? We talked in the previous slides about things that could lead us with some fancy words to improve ourselves. However, when we start the improving journey, it is not something like, okay, I like this technology, okay, let's bring it and use it, or we like this AI tool, let's bring it and take it. We have to have a look from the top of the pyramid. So what is the vision? What is the vision that we have if we want to improve the healthcare system in a specific hospital what is the vision of the hospital. If we want to talk about the healthcare system at the higher level, let's say at the national level of Saudi Arabia, let's have a look. What is the vision of Saudi Arabia? Is it one of the main priorities of the vision of Saudi Arabia? The answer is yes. It is here. At the vision, we have to improve the healthcare system. It is written Health Sector Transformation Program. When you access the Vision 2030, you can find it at the first page to improve the healthcare system. So the vision is available. After that, we have to go through several steps instead of just jumping to the technology and take the technology. Because of taking the technology before the proper arrangement or proper steps that should be taken before, this could lead to some failure. When we have a look here, after knowing that the vision is putting healthcare as a priority, we have to have a look about the status. We have to assess ourselves. Where are we now? Where to go? Assessment should be not based on emotional level or emotional judgment. It should be based on numbers and comparing with some other countries. In the academia we said with benchmarking. So we have to compare with rigid benchmark. And we have to follow some standards, practices, just to lead this change. How to follow this? There are some practices, a lot of practices. I gave here an example, is the ITIL practice. Some of you already know the ITIL practice. Before we giving this technology a kick in the market of the healthcare system, we have to think first, what is our vision? So we know now what is the vision, what is the 2030 vision, it is supporting this. The second question, where are we now? We have to assess ourselves clearly. And after that, where do we want to be? If you ask me, where do I want to be here in the healthcare system or services, I wish if we can see ourselves in the top 10. And it is not a thing that we say impossible, it is possible, just with the proper work. And after that, we should take the action. Then we will ask some questions, because even after we take the action, sometimes action could be correct or wrong, or we could reach the point or not, or maybe partially. We should ask ourselves, did we get there? If yes, or even no, we could ask the other question, how to keep the momentum going. If now there is a particular person or group of people that are supporting this vision or this work based on the ministry, the hospital, or the government level, if later some ideas changed, if the ministry changed, if some hospital leader changed, how to keep the momentum going, how to keep the support, how to keep the work to remain at the top. If we're looking to be at the top 10, it is not that difficult. But the difficult thing is how to remain in the top. And I'm sure that most, even if not all of the Gulf countries and some of Arab countries, they have the potential to be at the top 10. So why not to be at the top 10? When we talk about AI, the common question, or the common question that could be asked by public people, they could say, what is AI? Artificial intelligence. Okay, the first thing that they start thinking about it is robots. But when we come to the industry, it is not only robots. I'm not talking about only robots. I'm talking about robots, of course. I'm talking about augmented and virtual reality. Virtual reality, just to summarize, using the glasses and talking about virtual world, how to engage this virtual world to the industry. Machine and deep learning, this is a huge industry and could be included and involved in any and every other sector. Machine and deep learning, how to predict many things in the healthcare industry and others. We will talk about it later. And also services in the service sector. How to automate services. how to make decisions correctly based on the machine. And AI is not replacing human. It is here for helping human to get better decisions, better services. We have to be in the top. The top countries, all of them, they're using AI everywhere. Okay. For AI applications, if you want to improve the healthcare system here, there is a joint research. I cannot say research, a joint report between Harvard Business Review and Sadaya. They concluded 3 main factors to improve the healthcare system here in Saudi Arabia. And when I say in Saudi Arabia, I mean that in the Arabian Gulf. We're all together, we are all sharing everything. So, we have to innovate systems or work on systems to early stages of disease prediction. We could find or develop systems to diagnose well, to help the medical services to provide better decision, and also to reduce the operational cost, which is obvious. So these are summarized by Harvard Business Review and Sadaya. McKinsey, they came and put extra factors that could be used as AI applications. But the list is not limited to this. So we can talk about chronic care management, care delivery, clinical decision support, diagnostic, triage and diagnosis, self-care and prevention and wellness. If we see here a lot of areas that could be improved, and if we touch any of these areas, we are adding to the national vision of improving the healthcare system. So when we talk about machine learning, I told you that machine learning is about prediction. I want to predict something before it happens. So what kind of predictions? Here, you can see a summary of some areas that could be used in machine learning. If you are doing your research, you can find any of these areas to work on any of these areas. If you are working in a company, you want to develop a product, yes, work in any of these areas. If you work in the government sectors, healthcare systems, Ministry of Health, it is all related to this. I'm not going to stop at every one of these points. Just because of the time, I want to summarize some of this. Automating the tasks. When we talk about service delivery, when I want to deliver services, one of the main differences that puts some countries on the top rank and some of these countries lower than the others, even if they are the same of the provided services, is the experience, the user experience, let's say, the patient experience. How did they feel when they come to the hospital? I'll give you an example. When someone go to the emergency and find the care or the health care or the service few minutes after they enter the emergency, they could be much better than some other people who enter the emergency and they ask them to wait few hours or even days. And it happened. In some countries, yes, it happened. Especially during COVID-19. When we talk here, also to improve decision making, enhance patient experience, dissatisfaction. When I talk about satisfaction, I'm not talking about patients only. Think about everyone included in the healthcare system. When I talk about patients, if patients are satisfied, but people who are working on the healthcare system are not satisfied. This is a drawback. So I have firstly to include all the stakeholders, we call them stakeholders, everyone included in the healthcare ecosystem to be satisfied. This is one of the points. Virtual nursing and healthcare, insurance. What about insurance? When we talk about insurance, if we inject machine learning and deep learning into the insurance services, I can provide better services based on the health conditions, based on the environment, based on the ages and the other factors. And all of these are factors could be included in the models that would be trained. And we heard about, or we've seen the first presentation is about training models, and we all in the area working on such projects. Some current research that we are working on here, or in my university, in King Abdulaziz University, we are working on behavioral machine learning. Behavioral machine learning, the main thing or the main outcome of this kind of studies is to predict the outcomes based on the behavior and some biometrics. So I can predict, let's say, the likelihood of diabetes. This is one of the projects that we are working on now. The likelihood of having diabetes based on medical history, based on the biometrics, and also based on the behavior. Some other groups in the university, they are working on virtual reality and augmented reality. They are doing excellent job, and they are leading now. And upcoming projects aiming to building executable products that will be ready to be launched in the market. Okay, so what should we do at the national level? Before talking about this, I've just read a report that published lately in May, I guess 29th of May, from the government. It's about the readiness of government sectors to utilize AI and digital transformation. I found that the health sector is scored at the top. I think they classified it as improved, not improved, advanced, sorry. It is advanced, which is in the top category. This means that healthcare system is ready to be on the top, among the top around the world. Before starting, as I mentioned before, this transformation, we have to make sure that the sector is ready. We call it enterprise architecture. Enterprise architecture, I have to reorganize to make sure that all the structure of the environment of the sector is well designed, again, based on benchmarks. After that, the governance. Why I talk about the governance? We heard about data breach, we heard about data security, we heard about some leaking, some people they were trying to, regardless data security, some people or some sectors they try to keep the data for themselves. As we mentioned, one of the challenges that data, how to obtain data. So, if we have the correct governance, which is setting the rules how to manage and use the data, Sadaya is doing an excellent job here, we can get the data. So data, we cannot work on any data. It should be correct, complete, and ready to use. There are some other features to use data, so we must rely on the data used. Building a national database. In some other countries, there is a national database. Here in Saudi Arabia, they already started building this. National database that could be accessible by any doctor in the medical field to see, read, and assess the medical condition of the patient after the regulation. So this should be regularized. The other points that we could discuss it later, supporting universities and research centers to improve our sectors. Just because of the time, this is my conclusion to our talk, and thank you very much for listening. The references are available if you want to get the references. If you have any question, and thank you for listening.